All right, welcome back to the deep dive. Today we're going to be exploring hormones.
Oh, fascinating topic.
Yeah, they really are. They're these chemical messengers, and they control pretty much everything in the body.
That's right. Everything from growth and development to metabolism to mood to sleep and reproduction and sexual function.
Yeah, so many things. And they travel through your bloodstream to organs, skin, muscles, tissues, everywhere.
It's really quite remarkable how they're able to coordinate so many different functions. They're essentially the body's intricate communication system.
Yeah, and like any communication system, if the message gets messed up or garbled or something, then things start to go wrong.
Exactly. And that's essentially what a hormonal imbalance is.
Yeah.
It's when you have too much or too little of a certain hormone. And this can lead to a whole cascade of problems.
Yeah. Now, when we say hormones, I mean, there are so many different
Over
hormones.
50 have been identified in the human body so far.
Wow, and more to be discovered, probably, right?
Oh, I'm sure. I'm sure there are many more that we haven't even discovered yet.
And together, all these hormones and the glands that produce them, that's what makes up the endocrine system.
Right, that's the system that's responsible for producing and regulating all of these hormones.
Okay, so we've got these hormones, and even slight excesses or deficiencies can have a huge impact on our bodies.
Absolutely. It can lead to changes that require treatment, whether it's medication or lifestyle changes. Sometimes it's just temporary, like when you're pregnant or going through puberty or menopause, but sometimes it can be chronic.
Yeah, and some imbalances might affect your health overall, while others will just kind of affect your quality of life, how you feel day to day.
Right. Some common conditions that can be caused by hormonal imbalances, things that we hear a lot about, irregular menstruation,
Right. Infertility, both men and women.
acne, even in adults,
Yep. Diabetes.
thyroid disease.
Obesity. So many different things can be tied back to hormones.
It's really quite fascinating.
Yeah. So let's talk about symptoms because, I mean, like we just said, there are over 50 hormones. They all do different things. So I imagine the symptoms of a hormonal imbalance must vary so much.
They do. They really depend on which hormones are affected.
So we can't really give a hard and fast rule about what symptoms to look out for.
That's exactly right. And that's why it's so important to consult with the healthcare provider if you notice any new or persistent changes in your health. It could be something completely unrelated to hormones, but it's always better to be safe than sorry.
Yeah, good advice. All right, so let's get into some specifics because we've talked in general about hormones, but let's break it down into some of the different types. Let's start with metabolic hormones.
Okay, so those are the ones that really control how our body uses and produces energy.
Right, our metabolism. So, what are some of the symptoms that might point to an imbalance with those?
Well, you might notice changes in your heart rate. It could be either too slow or too fast, sort of out of the ordinary for you.
Okay.
Unexplained weight changes, either gaining weight or losing weight without any real changes in your diet or exercise habits. Fatigue is a really common one.
Yeah, I was going to say fatigue, that's such a general symptom, but I bet it could be tied to so many different things,
It can.
including hormone imbalances.
Absolutely. Also digestive issues like constipation or diarrhea. And some people experience numbness or tingling in their hands.
Okay, so really kind of all over the place.
It can be. It can be.
And what about things like cholesterol and mood? Can those be affected by metabolic hormones?
Absolutely. High cholesterol can be a sign of a metabolic hormone imbalance. And mood changes, things like depression or anxiety, those can also be related to hormones.
Right. It makes sense because your hormones are affecting everything that's happening in your body, so of course it would affect your mood as well.
It's all connected.
Yeah. Okay, what are some other signs that we should be on the lookout for?
You could notice changes in your skin or hair. It could become very dry and coarse, or maybe unusually thin and moist.
Okay, interesting.
Also, the distribution of fat, how your body fat is distributed can change. You might notice darkened patches of skin, especially in areas like the armpits or the neck.
Oh, like acanthosis nigricans?
That's right. Acanthosis nigricans.
Yeah.
You could also develop skin tags and extreme thirst and frequent urination.
Wow. That's a lot.
Yeah, it can.
So if you're experiencing any of those, definitely good to talk to your doctor. Rule out anything serious.
Exactly.
All right. Let's move on to another category of hormones because this is so fascinating. I want to talk about sex hormones. Obviously, huge differences between men and women, and those are largely driven by hormones. For women, we're talking about estrogen, progesterone, androgens. What happens when those get out of whack?
Well, women might experience more acne breakouts,
Okay.
hair loss,
Mm.
changes in their menstrual cycle, so their periods might become irregular or heavier or lighter than usual.
Yeah.
Some women experience hirsutism, which is excessive hair growth in areas where women don't typically have a lot of hair.
Right, right.
Hot flashes,
Oh, yeah.
difficulty getting pregnant.
Infertility, loss of libido, so decreased interest in sex, and vaginal dryness or atrophy.
Okay, so a lot of different things there.
Yeah.
And then for men, we're largely talking about testosterone, but there are other sex hormones at play as well. What are some of the signs of imbalance there?
Well, men might experience a decrease in body hair,
Okay,
erectile dysfunction or ED.
right.
They might develop gynecomastia, which is enlargement of the breast tissue, infertility, loss of libido as well, so decreased interest in sex, and loss of muscle mass.
Okay, so again, a wide range of symptoms, but some pretty specific ones there that might point to a hormonal issue.
Right.
Now, we've talked about a lot of different things, but I want to touch on something specific that we hear a lot about. The link between hormones and weight gain, particularly for women. Can you explain that a little bit more?
Sure. There are a few specific hormonal imbalances that can contribute to weight gain. Hypothyroidism, which is where your thyroid gland doesn't produce enough thyroid hormone, that can slow down your metabolism and make it easier to gain weight.
Cushing's syndrome, which is a condition where you have too much cortisol,
Mm.
that can also lead to weight gain, particularly in certain areas like the face, abdomen, and upper back.
Okay.
And then menopause. Of course, during menopause, women experience a lot of hormonal changes, and one of the effects of that can be weight gain. But it's important to remember that menopause is a natural process.
Right. It's not a disease state. It's just something that happens naturally.
Exactly.
So the weight gain associated with it is also considered normal.
Right.
Okay. And another thing that we hear a lot about is the link between hormones and anxiety. Can you speak to that a little bit?
Yeah. So certain hormonal imbalances can definitely contribute to feelings of anxiety.
Mm.
Hyperthyroidism, which is the opposite of hypothyroidism, where you have too much thyroid hormone, that can make you feel anxious, nervous, restless, and irritable. And Cushing's syndrome, with that excess cortisol, can also lead to anxiety, along with other mood changes like depression and irritability.
Yeah.
And interestingly, even adult-onset growth hormone deficiency has been linked to increased anxiety and depression in some studies.
That's so interesting how just these chemical messengers can have such a profound effect on how we feel mentally.
It really is remarkable.
So we know that hormone levels naturally fluctuate throughout our lives, when we're going through puberty, pregnancy, menopause. What are some other things that can cause our hormone levels to change?
Well, stress is a big one. When you're under stress, your body releases hormones like cortisol and adrenaline, and that can have a big impact on your overall hormonal balance.
Right, right. Makes sense.
Certain medications can also affect hormone levels, and the use of anabolic steroids can really disrupt your natural hormone production. But these types of imbalances are often temporary. They tend to resolve once the stressor is gone or the medication is stopped.
Okay, so those are kind of the everyday things that can throw your hormones off, but then there are more chronic and medically significant imbalances, right?
That's right. And the causes of those can be a little more complex.
So what are some of the things that can cause those more persistent imbalances?
Well, tumors or adenomas or other types of growths can develop on or near the glands that produce hormones, and that can affect how those glands function.
Oh.
Sometimes physical damage or injury to those glands can cause imbalances, and autoimmune conditions where the body's own immune system attacks the hormone-producing glands, those can also lead to chronic hormonal imbalances.
Yeah, and autoimmune conditions are becoming more and more common, unfortunately.
They are.
And there's still so much we don't know about why they develop in the first place.
That's true. There's a lot of research still being done in that area.
So you mentioned tumors and adenomas and growths. Can you give us a little more detail about some of the specific types that can cause problems?
Sure, there are some rare endocrine tumors that can secrete excess hormones. Things like adrenocortical carcinoma, which is a cancerous tumor of the adrenal gland, carcinoid tumors, medullary thyroid cancer, pheochromocytomas, and paragangliomas. Those are all pretty rare, but they can cause significant hormonal imbalances.
Okay. And then adenomas, those are benign, right?
That's right, they're non-cancerous.
But they can still cause problems.
They can. So adenomas can develop in any gland, but when they develop in endocrine glands, they can sometimes cause the gland to produce too much of a particular hormone. For example, pituitary adenomas can cause acromegaly, which is where you have too much growth hormone. Adrenal adenomas can cause Cushing's syndrome, and parathyroid adenomas can cause hyperparathyroidism.
Okay. So it's not the adenoma itself that's causing the problem. It's the fact that it's making the gland overproduce hormones.
Exactly. It's like it's putting the gland into overdrive.
Okay. Okay. That makes sense. Now, what about growths like thyroid nodules? Those are often benign, but can they still mess with your hormone levels?
Yeah, they can. Most thyroid nodules are inactive. They don't cause any problems. But some can become overactive and produce too much thyroid hormone, which leads to hyperthyroidism. And larger nodules can sometimes interfere with the normal function of the thyroid gland, which could lead to hypothyroidism.
Wow. So just these little lumps in your thyroid can have a pretty big impact.
They can.
You also mentioned damage to the endocrine glands as a potential cause of imbalance. How does that happen?
Well, it can happen in a number of ways. Sometimes it's accidental damage during surgery. For example, if you're having surgery on your thyroid or in your neck, there's a risk that the parathyroid glands could be damaged, and that can lead to hypoparathyroidism.
Okay.
Sometimes it's a lack of blood flow to the gland, for example, in Sheehan syndrome, which can happen after childbirth if there's severe blood loss. That can damage the pituitary gland and lead to hypopituitarism. And certain infections, although it's uncommon, can also damage the endocrine glands. Radiation therapy, which is often used to treat cancer, can also damage the glands, particularly if the radiation is directed at the head or neck area. And physical trauma to the head or brain can damage the pituitary gland or hypothalamus, which can disrupt hormone production.
So a lot of different things there that can cause damage to these very important glands.
That's right.
And then, of course, we have the autoimmune diseases that we talked about earlier. Can you remind us how those affect hormone production?
Sure. So in autoimmune diseases, the immune system mistakenly attacks the body's own tissues. And when it attacks the endocrine glands, it can damage those glands and prevent them from producing hormones properly.
Right.
Some common examples of autoimmune endocrine conditions include Hashimoto's disease, which affects the thyroid gland and often leads to hypothyroidism. Graves' disease, which also affects the thyroid but causes hyperthyroidism. Type 1 diabetes, where the immune system attacks the insulin-producing cells in the pancreas. Addison's disease, which affects the adrenal glands. And polyglandular syndromes, which can involve multiple endocrine glands.
Wow. So we've covered a lot of ground here.
We have.
We've talked about so many different things that can cause hormonal imbalances. So let's say someone suspects they might have a hormonal imbalance. What are the first steps they should take?
Well, the first step is always to consult with a healthcare provider.
Of course.
They'll take a detailed medical history, ask about your symptoms, and perform a physical exam. And then they'll likely order some blood tests to check your hormone levels.
Okay. And are there any other tests that might be used besides blood tests?
Sometimes, depending on the suspected imbalance, they might do other tests, like a glucose tolerance test or an insulin tolerance test. But blood tests are usually the first line of defense.
Okay, that makes sense. So once a diagnosis is made, what are the typical treatment options?
Well, it really depends on the cause of the imbalance. If you have lower than normal levels of a hormone, hormone replacement therapy is often the first line of treatment. That could involve taking pills, like synthetic thyroid hormone for hypothyroidism, or getting injections, like growth hormone injections for growth hormone deficiency.
Okay. And what if the problem is that you have too much of a hormone?
Then the treatment might involve medication to block the production of the hormone or surgery to remove the gland or tumor that's producing too much of the hormone. Sometimes radiation therapy is used to shrink tumors or reduce hormone production.
Okay, so there are a lot of different options depending on the specific situation.
Right.
Now, we talked about supplements earlier, and I know a lot of people are interested in those. What's your take on using supplements to balance hormones?
Well, I always recommend caution when it comes to supplements. It's important to remember that they're not regulated by the FDA in the same way that medications are. So there's no guarantee that they contain what they say they contain or that they're safe and effective.
Right, so buyer beware.
Exactly.
Yeah.
And it's important to talk to your doctor before starting any new supplements, especially if you're already taking medication, because there could be interactions.
Good advice. Now, are there any lifestyle changes that can help to manage hormonal imbalances?
Yeah, absolutely. Things like managing stress, exercising regularly, getting enough sleep, and eating a healthy diet, all of those things can have a positive impact on your hormonal health.
Okay. So it's not just about medical intervention. There are things that people can do on their own to help themselves.
Right.
And if someone is dealing with a suspected hormonal imbalance, what type of doctor should they see? Is their primary care doctor enough, or do they need to see a specialist?
Well, a primary care doctor can definitely manage some of the more common hormonal imbalances like mild thyroid disorders. But if the issue is more complex or if they're not sure what's going on, then it's a good idea to see an endocrinologist.
Okay, and just to remind our listeners, an endocrinologist is a specialist in hormones.
That's right.
So they're the experts in this area.
Exactly.
Any final thoughts or advice for our listeners on how to keep their hormones happy and healthy?
Well, I think the most important thing is to be aware of your body and pay attention to any changes. If you notice anything that seems out of the ordinary, or if you're just not feeling like yourself, don't hesitate to talk to your doctor. Early detection and treatment is key for many hormonal imbalances.
Such good advice. This has been so fascinating. I feel like I've learned so much about hormones today.
Me too. It's a really interesting topic.
It is, and so important for our overall health and
It
well-being.
really is.
Well, thank you so much for joining us for this deep dive. We hope you found it helpful and informative. And remember, if you have any concerns about your hormonal health, please don't hesitate to reach out to a healthcare professional.
It's the best thing you can do for yourself.
Absolutely. Thanks again for listening, and we'll see you next time on The Deep Dive.